Yeah.
Okay, so the anchor, so when you say the anchor, so we're trying to find out in their history what is a primary contributing factor to the onset of their initial low back pain. Is that right?
Yes.
So car accident, whatever, right?
So mechanism of injury and then need is how it affects your life.
Okay.
So because we're trying to, so like in my case, when this is not role play, this is just real.
Yeah.
So when I first saw one of the doctors here, I'd never been a chiropractor, and I just heard all the time I'd had a headache for 8-9 years. I just assumed everybody heard all the time. It felt like that. And when the doctor kept asking me about it, I got hit by a car 15 years ago. And then my secret was just taking tramadol. So it's great. It totally worked.
Wow. Okay.
And in my head, my issue was that I was just getting older, that I felt like this for 15 years and I worked 18 hours a day at times and it just was sucky. And he's like, no, you got hit by a car and did nothing about this. And so for me, it was like, oh, I get it. Like being hit by a car is a bad thing.
Okay.
And so you're not like, it's not that you're grasping at straws. It's that you're trying to find a mechanism of injury to help them understand the severity of what's going on.
Right.
So in this case,
that's easy to do. That's easy to do unless somebody says, I got no car accidents, I got no work injuries, I got no sports injuries, I got no fall, I got nothing I can contribute to that. And then that kind of sends them into, I must be getting old, and we don't want to go down that road. So what would we do at that point to anchor them?
So if it is getting old, then that's an okay reason too. Periodically, we'll have patients who don't have anything in their life that's happened to them that they can think of.
Right.
And so you say, all right, so you're feeling like you're just deteriorating.
Well, the body's just normal wear and tear.
Yeah. And so how do we address that? Let me figure out what's going on. And then you jump into, what is this normal wear and tear inhibiting in your life?
Yeah.
How's it affecting you at work? And then you can jump into that need to be able to draw the connection between what they're losing.
Okay, so before we jump into need, after this comes during the time that they're laying out all their complaints, right?
Yes.
And then when we anchor, we're trying to anchor their primary complaint, right? Say they say low back pain and neck pain, that their low back is the worst, right? So we want to try and anchor their low back, right?
Yeah. Well, yeah.
All right. Got it. All right. And then once we get it anchored, once we get them to understand that there's some sort of factor in their past that started this whole thing, right? Then we move into how's it affecting your activities of daily living, your work, your sleep, leisure, that kind of thing, right?
Yep. And when you're getting need, you don't have to get every aspect of it. So in this case, when our good friend John, or whatever his name was, or Kyle, I guess that was his nickname. When you were going on the line, the question you started out with, well, how's it affecting you at work? And he was almost not quite done talking about it, where you could have pushed a little bit harder. So you're going to have problems with continuing to work. How are you going to pay your bills? Like asking.
So this is where we start really digging.
Yep. Yeah.
Okay.
So once you've got a hit, they say, I don't, how's that affect your family life? I don't like my family. Okay, well, how's that going to affect your work life? I hate going to work. All right, well, how's it going to affect your leisure? Oh man, I can't play pickleball and I can't do all these other things. So you're looking for a hit, and once you've got a hit, you want to develop it a little bit more to understand. Is that what they're really worried about? Like, are they worried that they're going to lose their leisure? Are they going to lose the ability to provide for their family? Because most of us, like the hard part in finding need is making sure that you're not typecasting people, because because most of the time the concern is, my concern was, how do I keep going to work for 18 hours a day or 12 hours a day, whatever it is, and being able to pay the bills to keep a roof over my head. And I go, well, shouldn't everybody be worried about that? And yes, but we want to figure out what's important to them.
Right. Well, exactly. I mean, I would think the primary, the catastrophic primary need is work. If they don't work, they can't take care of their family. But the primary pleasure need would be spending time with their family.
Yeah.
Right?
And so in that case, he talked about, he was worried about not being able to play with his kids. Like, he likes to wrestle with them. All of a sudden he can't even do that anymore. And
but
so
here's the thing though, wouldn't you say, I mean, as long as he can still go to work, if he isn't that the last thing, is that if he can at least still go to work, he can still provide for his family. Maybe he can't play with his kids anymore, but he's still providing for them. So I would think that work is at the top.
Yes, and that's why it's important to develop that need, is to figure out what's important to that person. And that's where it's really easy to typecast people, is because that, I mean, for you and me, that is obvious. Like, if you can't go to work, it doesn't matter about all these other things.
So the need's going to be work, and the importance is going to be family.
Yes. Yeah.
All
so
right.
you're looking for whatever it is that they're worried about, that you're going to be able to fix. So if you come in and you do these treatments, and I'm able to figure out what's the matter with you, and then how we can possibly get you better so that you can do this, would you be willing to follow through on these treatments? Yeah. And day 2, 3, and 4, especially as you're getting ready to close this program, you're describing the treatments, that you're helping them to understand that your goal is to get them back to doing the thing that they fear losing out on, or have already lost out on.
Right.
So if they love work, then it's getting them back to doing a good job at work. If they are frustrated because they're losing out on family time. So in my case, the big thing that really was frustrating and overwhelming for me was that I was a really sucky parent. Like, and it was very hard for me to admit that, but because I hurt all the time, I hurt in the morning, I'd go to work all day, I'd come home and I'd hurt even worse. And then my secret method was I would then yell at my kids. It was great. I felt good about myself. And then sit there and go, I'm literally the worst dad who's ever lived. Like, it's not their fault that I hurt all day. And then go to work and then hurt even more. And then I come and yell at them because I just am running at a 9 all day long.
Right. Okay. All right. So, so getting into that area of the primary need and the need versus importance, it's we can spend a little time digging into that, right?
Yes.
That's where you're going to really get them to sit up in their chair, right?
Yes. And so when you're going through the list of things, I can't move that.
That's okay.
If you're not getting a need, it's really hard to go forward, because the likelihood that they're going to value all the other things after that point is very low. When we have, so out of the several hundred patients that I've sat through with this on, the ones that we usually don't sign or go through with care, there's confusion about money, or the big one is they don't see the value because they can't connect it to need.
Exactly.
So, and that need one is number one. It's the one that usually, if we can't figure out where their pain point is, we don't know how to help them connect the treatment.
And the reality in this is that there's going to be 15% of those people that are going to be in that boat, no matter what we do, right?
Yeah.
But we still give it the same shot with everybody. Yeah. All right. I like that, because it's like, hey, it's not our decision, right? It's their decision. We just give them the information to make an educated choice. Yeah.
So we're trying to find every way to get to it. Okay. So besides those two,
right. Yeah. I got it. Yeah. All right.
So on these other, so besides those two, so Chris, just to recap really quick, we were talking about the difference between anchor and need. And anchor is the mechanism of injury, and then need is what has been inhibited in their life that we're trying to find a fix to. So so we got all the way up to summarizing, and then you got to looking for any other problems. So
Yeah,
I'll be Kyle if we want to pick up at summarizing any other problems.
Okay. All right. So Kyle, so basically what I got is you have your main concern is low back pain. The pain started radiating down your right buttocks and into your right leg to your knee. And this has been going on for 2 years. It's not getting any better. It's actually getting worse. You actually have lost days of work because of it. And you can no longer play with your kids.
Yeah.
Is that concerning?
Yes. Here, and I'll give you an anchor. I was at work and I tripped and fell on my butt. So it hurt really bad, and then I just took some Advil and thought it was
okay. All right. All right. So Kyle, so I'm gonna get this straight. You've had low back pain. You started with low back pain 2 years ago because you had a ski injury. Is that correct? Okay.
Yes. Yeah.
And the pain lasted for a couple of weeks and it went away, and you thought you were okay, correct?
Yeah. Yeah.
But now it's been coming and going over the last 2 years. The frequency of your flare-ups have increased. The intensity of the flare-ups have increased, and the longevity of each flare-up has increased. And now you have leg pain. Is that correct?
Yes.
Okay. Yeah. Does that sound like you're getting better or worse, Kyle?
It's worse.
Does that concern you?
Yeah, it freaks me out.
Okay.
Yeah.
Now, more importantly, it's affected your ability to work. Is that correct?
Yeah.
And most importantly, it's affected your ability to have family time free of pain, playing with your kids. You no longer can get down on your hands and knees and play with your son, right?
Yeah. I mean, I can muscle through work and I make it work, but then I get home and I'm done.
Does that bother you? Does that make you feel bad?
Yeah, I hate it.
Play with your kids. Does it make you feel like you're ignoring your child?
I feel like a bad dad.
Yeah, you're not a bad dad, are you?
I didn't think I was.
Of course you're not. You're not. You just can't do these things because your back hurts so badly, right?
Yeah.
And that's not okay with me either. And that's why we're here. We're here to help you find out what's causing your back pain. Initiation with the ski injury, but there's injuries that were sustained that have not gotten any better. You've not gotten any treatment for it, and it's now getting worse. It's our job to find the problem and to put together a treatment program to treat the problem, get rid of your pain, make you more flexible, make you be able to get down on your hands and knees and play with the kids, right?
Yeah. Yeah. Yeah.
Great. So what we're going to do now is we're going to go and we're going to do a thorough exam. We're going to take a look at your back, but I'm going to examine your entire body. Okay. Okay. And we're going to we may find things that are doing great on you, but I want to do a full orthopedic, neurological, chiropractic exam on you so we can pinpoint what's causing your symptoms that you came in to this office for. Does that make sense?
Yeah. Yeah.
Okay, and then I would transition, into the exam. I would talk to him about, Kemp's test, double straight leg raise, direct digital palpation. Each time I'm doing these things, I'll have him lay face down. I'll push on his right trap area gently and say, this is how hard I'm pushing, so I qualify it. Then I'll start in his low back on his SPs, and I'll just start going up. And I'll say, you tell me what areas are tender when I'm pushing on this, because each area that I push on, I'm moving that vertebrae. And if it's inflamed, it's going to be painful. So you need to tell me. And then I'll just go right up the back and then mark each area. I'll mentally mark each area that he's having problems with. And then, flip him over, do a check of his neck. If I find anything there, I'll say, look here, right here, your neck is restricted. It's not moving. I can tell your muscles inflamed here. Even though you don't feel pain, Kyle, you have a problem here. We'll talk about that later, and I'll just keep moving on until I get to the end of it. And then Now, when you guys get through with your entire exam, talking with them about it and everything like that, you're all done. You turn around, sit down right there and give them the diagnosis, or do you just kind of leave the room for a second, give them a minute to digest what you just did, and then walk in and say, Kyle, look at me. I want to tell you, I found what your problem is. You have a bulge disc with torn tissue and torn ligaments, which is causing inflammation, muscle spasm, and pain. I can help you.
You don't normally leave the room, but you will want to stop and just
Pause.
Dramatic pause.
Dramatic pause, right?
Yeah, just say, hey, look, I've done this. I'm not 100%, but just based on this exam, this exam that we just did, it appears that you have torn or bulging disc, torn ligaments, whatever it is. And I think I can help.
Do you say, I think we can help, or do you say we can help you?
Can you help him?
Of course we can. So I'm going to say, okay. I'm going to say, Kyle, based on my exam findings, your problem is you have a bulge disc. You have tissues that are torn, you have ligamentous damage, you have inflammation, and you have muscle spasm. That's causing your pain. That's your problem. I can help you.
Okay. Yeah. If you can say it with conviction and you believe it, then yes, you want to be able to do that.
Now, to help us even more pinpoint your diagnosis and also get a look at the health of your spine, we're going to want to take some minimal x-rays. That's going to give us a picture of what kind of shape your neck and back is in. Does that make sense?
Yes.
Okay.
Okay.
And what I'm going to do is we're going to do some treatment today on you. We're going to get some x-rays taken. All right. And then we're going to talk about how your body is going to heal and how we can help you tomorrow. Does that sound good?
That sounds okay.
All right. So then, that you send them down to the x-ray room. Is that right? Is that what you do next? When do you guys take the x-rays?
Mm-hmm. Oh, when do we do it? So
yeah,
immediately, once you've given them your diagnosis and say, you've got this issue, and then you tell them, we're going to go take some x-rays. I need to be able to study those to make sure that I know exactly what's going on inside of there. Let's head back to the x-ray room. And you take them back right then and go shoot the x-ray.
Okay. So they come back from x-rays to the whatever room, mm-hmm. and you say, okay, I'm going to take some time to process those x-rays, to study those x-rays, and come up with a report that we will go over with tomorrow. Okay. Right now, we're going to get you some treatment.
Nope. So the next step is you're going to talk about phases of healing.
Oh, okay. All right. I thought you did that. I thought you did that after the treatment and when you're releasing them. Okay. So then I would go, all right. So right now, before we start treatment, I'm going to talk to you about how your body's going to heal. And these are what's called the 3 phases of healing. There's the inflammatory phase, there's a repair phase, and there's a remodel phase. And they're all very, very important. It's very important for my patients to understand these 3 phases. And we will tell them to you, in a very cohesive way that you'll understand. But it's really good for you to understand this, because when my patients are educated, it allows them to understand how their body is healing and what we're doing here to help them heal. And it works as a 2-way street between me and my patients, and they do better. So the first phase is inflammation. That's the phase you're in right now. Okay. That's why you have a lot of pain. You have a lot of inflammation. The second phase is the repair phase. This is when your body starts to heal. And in that phase, there's scar tissue that's laid down. It's not the good kind of tissue, and we'll talk more about that. And then there's the remodel phase, where the body starts to strengthen itself, and it lays down tissue that's good tissue. And I'll talk to you more about that. Here's a handout with the 3 phases of healing. I want you to take a look at that between now and tomorrow, so that you can understand a little bit better about what we're talking about. And we'll make it real simple, but it's real important for you to understand. Does that make sense, Kyle?
Yes. Okay. So in this part of it, so you want to briefly just describe the 3 phases. Okay. So we've done our x-ray. We're going to talk about how you heal. So there are three phases, the three phases of healing. There's inflammation, repair, and there's a remodel phase. We're going to talk about the inflammation stage. That's where, or the inflammation phase, that's where you're at right now. And then you're going to jump into the actual discussion of inflammation. You'd say, okay, here's your spine, here's and then you're gonna jump into that. You're gonna identify and talk about the four main features of the inflammation stage. So increased nerve sensitivity, weakness, the others, and really address those four and make sure that they're getting a good understanding of what that inflammation stage looks like.
Okay.
Because day 2 and day 3, day 2 is going to be the repair phase. Day 4 or day 3 is going to be the remodel phase.
Okay. Okay. So the repair phase? That's the phase with is that the phase? That's the phase of the decreased strength, decreased flexibility, increased nerves, increased pain, increased hypersensitivity, right?
Yes.
Okay, that's the repair phase.
Yes.
Okay. So what are we saying for the inflammatory phase? Just this is.
Oh, no. That's the inflammation stage.
That's the inflammation phase. All right.
Yeah. The repair is, and the inflammation should last, 72 hours ish. It should be a short time unless we continue to re-injure it every time. You damage your ligaments and then you go do stretches and stuff thinking that's going to fix it, and so you continually are aggravating that and re-inflaming the issue.
Okay. All right, got it. I mean, they sort of overlap a little bit because
absolutely,
in the repair phase, the type of tissue being laid down is scar tissue, which is also not flexible, it's weak, and it's painful, right?
Yes. I have a pen, but on here you'll notice like that first phase is just a quick. You can't see it. It's like a quick blip. That repair phase starts within that other one and goes this way. And then that remodel phase will sit there and stretch out over. They overlap each other as they're doing it.
Okay. All right. But we're just talking about listen. Okay. So at the end of the first day, we're saying the three phases of healing is inflammation, repair, remodel. We just simply say repair, remodel, and then we expand on inflammation. That's
correct. Yes.
All right. Got it. So then go ahead, Chris. Oh, I have somebody else in the back. So, okay. So when you get done, explain the inflammation, then you do treatment, right?
Yep.
Okay. And you guys what do you do for treatment for your first day?
I mean, whatever's necessary. Usually, depending on their complaint, they'll do a lumbar adjustment, cervical adjustment.
Do you do anything like interferential, hot pack, or anything like that?
Only, I mean, if you think that they need it, then yes. That part is just the treatment, whatever you think they need to do, because your whole goal with that treatment is to start getting them out of the inflammation stage.
Interferential helps a lot with that. I mean, that's a good modality for that. So that's why
so I mean, if it works, then do what works. You're the chiropractor.
Right. But let me ask you a real quick, Chris. You got anything? Let me ask you a quick question then, because the way your guys' office is set up with your repair and remodel phase is based on the traction, right?
Yes.
The adjustment, but mainly the traction. You get that sustained movement to create the class 1 collagen over the class 3, right?
Yeah, type 1.
So I don't have all that equipment that you guys have, but I do have a couple. I got a couple of those, cervical pumps where they lay flat and they pump up a little bladder that goes behind their neck, right? And then I do have a Leander table in storage that does that,
Yes. Yeah.
Okay. So are those a couple things that I could use to at least do some sort of minimal traction therapy?
Yes. Yeah.
Okay.
So cervical's good. I mean, that's especially like I can't remember like the bands type of thing, right? So where you're pulling, as long as you're getting that stretch, it's not as effective as the sustained, like the weight-based traction, where you can get a sustained stretch. But I mean,
Well,
anything
beyond,
better than nothing.
you're getting both the stretch and the traction at the same time. That's the problem.
Yes.
I'm not getting the actual pulling part and then the stretch from up with the cervical, right? You got that and that going, right?
Yes.
When you're laying on the table with my thing, you just got that going, just the anyway. I'm just saying, because I have a limited amount of rooms. I can't tie up the rooms for too long. Right now my rooms are tied up for about like 20 minutes.
Okay.
So right now 20 minutes. Like if I have an auto, say 20 minutes, I've got laser going at the same time. I got interferential going and a hot pack going. And so that therapy is going to be about 20 minutes. And then I walk in and I adjust them, and then they're out. Then they do their exercises, and then they're out the door.
Okay.
So, but I'm going to talk to Dr. Tom more about your guys' actual traction setup, because I think that's where I want to go in the future. I'm just have to find space a space to do it in. So anyway, all right. What's next?
Okay. All right. So then you treat me, and then this is I'm not going to say it's the most important part, but it's the most important part. You get done with all of this, you've found their need, you've done the treatment. So there's two things that you want to do. The first is that you need after you've done the treatment, you need to warn them.
Do what?
You need to warn them.
Okay.
You're going to warn them and say, hey, look, we're freeing up 2 years worth of damage. It looks like that you have scar tissue and things like that, and we're going to adjust that. Most people after this first adjustment will be more sore than they were before they came in. I was looking at a study a few months ago. Again, it's like 40% of people who come in for that first chiropractic adjustment don't come back in because they feel worse than they did after the first visit.
I tell them, I said, if you've never been adjusted or haven't been adjusted for a long time, your reaction to the adjustment is going to be, you're going to feel a little better, a little worse, or no change at all. That's all normal.
Yeah. So they should expect, you tell them you should expect to be a little more sore. And then when you've warned them, then take them up to the front desk. And you want to make sure that you're personally walking them up to the front desk, and telling your front desk person what you want them to do. I say, look, I've seen Kyle here. We had a great visit. I need him to come back tomorrow, so that we can go over other stuff, day 2 stuff. If you can arrange that, I need to see him tomorrow. And what you're doing is you're doing 2 things. One is you're showing the patient that you're serious about them coming back, and you're also allowing the front desk person to just follow through on what you just said. Because otherwise you say, all right, go up to the front desk and get your next appointment scheduled. They'll go up and they may or may not schedule that next appointment.
Almost exactly the same, right? Like, hello, my name's Chris Jones, or Dr. Jones. I'm still getting used to saying that. Hello, my name's Dr. Jones. Can I ask how you heard about us?
I went and saw Dr. Gamby here at the chiropractors, and so he recommended you.
Great. Yeah. Well, I'm super glad. That's great you're here today. So it says here on the chart that you're coming in for I guess really I should just say, what brings you in today?
So I've got this low back pain. It's just real bad low back pain.
Okay. So I'm going to give you a hint here. I don't do intradiscal injections.
I mean, my knees are just wrecked from my skateboarding.
Okay. Well, I'm super. So you're a skateboarder. Awesome. Yeah. I love skateboarding. Yeah. I'm just really clumsy, so I don't do it very much. But thank you. It sounds like something I can probably help you out with.
Oh, good.
So is anything else giving you problem? Does your hip hurt or does your ankle hurt?
I mean,
or
my
even
knees
down
and
your lower
my.
back.
Do you do hips?
Yeah, we do. I do. I can also do facet joints. I just don't.
Okay.
So if you tell me you have a bulging disc, I'm not going to shoot your disc up. I'll get the
Yeah.
facet joint to calm down the facet irritation. But I think typically I'll be doing periphery. So hips, ankles, knees, elbows, shoulders, and the
Yeah. So like
occasional.
my hips and my knees are just
Okay.
they're real sore, and I've been skateboarding for a long time, and I hurt. So
Yeah.
they're just perpetually sore.
Okay. Well, I'm sorry to hear that. And wow, sorry, I've been listening to you guys do it, and I'm hearing all the background information. Um, so it sounds like hip and knees are what's bothering you, and you think it's related to your skateboarding, if I'm getting that right.
Yeah.
If we were in the office, I would ask you to stand up and could you point to exactly where it hurts for me? I would take a look at that. I may touch it at that time. And then also, how bad does it hurt on a scale of 0 to 10, 0 being no pain and 10 being you're going to the emergency room? Where would you put your pain?
They're like a 7, 8.
7,
It's
8.
pretty
That
bad.
sounds like it's pretty bad. And what is that all the time, or does that come and go throughout
It's
the
all the
day?
time. It's all
Oh
the time.
man, I'm sorry to hear that. What quality? So when I say quality of pain, I mean like burning, shooting, like a sensation of ants on your legs,
Like it's
or
here.
throbbing.
I'll just give you a real one.
Okay.
So I have viral arthritis. I got COVID back in October of 2020, and it comes and goes. It flares up. I've changed my diet and I do more exercise, but it feels like I have glass in my joints, like
Okay.
in my knees and ankles and elbows and wrists and stuff. So it just feels like I have glass grinding in there or like sand. Like I got
Yeah.
sand in there when I move.
And do your joints ever catch?
Do they what? Do they
Do they ever
catch?
catch or give out?
Yeah, and my arms they catch. My legs don't. This is not role play. This is real.
Okay.
Yeah. So like in my arms, they'll catch a little bit, and my legs, like I just kind of power through.
Yeah.
I mean, I have to go to work. So
When I do come in for training, I'm pretty sure I'm going to be doing some free injections for some of you guys. So just get in line and I'll hook you up.
I mean, will it work?
Well, I think with PRP, there's potential there. I've never read anything about PRP and COVID related symptoms. I do know, however, that PRP does work with a lot of arthritic conditions and provides, whether it's permanent or temporary, can provide some relief. And typically that relief comes in the fact, because basically those platelets are releasing growth factors and other things, but there also seems to be an anti-inflammatory component to it. And so because that's true, I think that, and also people typically don't respond badly to their own blood products. It would be harmless if it didn't help you, and potentially you could see some benefit from it. But I don't think it would be harmful unless, like I said before, you have osteophytic changes, you're bone on bone. Like, I don't think you'll get a lot of benefit out of that.
Yeah. Okay.
But anyway, so the role play.
Yeah.
So we talked about wear, we talked about severity, we talked about quality and frequency. So how long has this been going on for?
Year and a half.
About a year and a half. And you said that this is after you got COVID in October. Was there anything else that happened? A fall, an accident, change in habits?
I mean, I was hit by a car 15 years ago, 16, I guess 17 years ago. I was riding my bike through an intersection. A lady broadsided me and then took off.
Oh, wow. That's terrible.
So it wasn't great. So my secret was my doctor gave me some tramadol for a week, and then I was taking Advil. I was taking 8 to 10 Advil a day for 15 years.
Wow, that's pretty
Not
significant.
great.
Yeah,
I know that's bad.
Right. Yeah. And so our goal is to get you off the ibuprofen, you know what I mean? And so hopefully, well, I can't say we're going to get you pain free because pain is part of the human existence. I can say that we can get you better. But let's really zero in on what's going on here. Does this affect what you do in your daily life? So does this also, it looks like we're going to get cut off again here in about a minute.
Yeah.
So they may need to resend the thing, but does this affect your work?
The arthritis, I mean, I just make it work. Like I just deal with it.
Thanks.
I don't know. I mean, yeah.
Okay.
It's not great. Like I walk like I'm 100 years old.
I hear you.
So
So you like,
yeah.
so
I
it sounds like
try
really
to minimize
mobility
the
may
amount
be
of
more of
moving.
an issue.
Yeah, like I minimize the amount of walking that I do.
Yeah.
Because it hurts.
Is there something that you would like to do that you don't do because of this problem that you're having?